Dr. Alan Maryon-Davis is an Honorary Professor of Public Health at King's College London, and he joins me live now for more. Thank you very much indeed for being with us on the programme, Dr. Maryon-Davis. So it seems there are signs of a second wave emerging, with cases in Spain rising at the highest rate since March. Is locking down again the answer?
Well, I think the first thing to understand, and as your report made very clear, this isn't a second wave. In fact, talk of a second wave is probably not the right term. It's the wrong concept, really, for this particular virus. It's basically, we're still in the first wave, but the first wave has died down to a relatively low level in parts of the world, but keeps bubbling up in other parts of the world. So we talk of spikes, we talk of outbreaks, we talk of clusters, we talk of bubbling up. It's the first wave. It's really basically the ripples of the first wave. It's subsided largely, but there are ripples, and it's sort of rippling around our feet. But every now and again, it splashes up to our knees and perhaps even higher.
Have we been too complacent, though, in easing up early in the middle of this wave?
Yeah, well, I think there is a danger of that. Yes, I think a lot of people think that the virus has gone away. They think the first wave is done and dusted, and they can relax now. And fewer people are doing the basic things like washing their hands. They're being a bit relaxed about social distancing, particularly amongst young people, where there's a particular problem because often the virus is asymptomatic in young people. They don't feel ill. They don't know they've got the virus. They think they can get together much more closely. And it seems to be spreading very largely amongst young people and then infecting older people. Yes, I think we are too relaxed about it, so we really do have to toughen our grip on this thing.
Well, I wanted to ask you a little more about younger people. We've seen lots of images of them gathering without any kind of social distancing by the looks of things. Should we put a stop to this, and how can we do that?
Well, that's a policy issue rather than a public health issue, in the sense that, we're not in a sort of police state situation where we can put a stop to that, except through local lockdowns. And there will be some cases where you can pinpoint the sort of area, or maybe a workplace, it may be a school or a college, although they're on holiday now, of course, but it may be a particular locality where you can put down a local lockdown and stop people from congregating in the way they're getting a bit too used to. So yes, that can be done to some extent. But what we are trying to avoid in every country, a big national lockdown.
And how big an issue is cross-border travel, do you think? Do we need to look at that more carefully and potentially minimise it?
Well, that is a big issue. This time of year, July, August, we are all doing. The temptation is to go on holiday to various places and to mix together over drinks or meals or whatever. Yes, that is very much part of it. And the advice really, in general, is to try to avoid cross-border travel if you possibly can. Essential travel only. And of course, in some places, there are quarantine rules imposed for people who come back from cross-border travel. So yes, that is a big issue.
OK, Dr. Alan Maryon-Davis from King's College London, thanks very much indeed for joining us.